Hello everyone, greeting from Docplexis and very warm welcome to all of you present here. I am Sipher from Docplexis. As we all know, Docplexis is one of the India's most trusted and leading digital platform dedicated exclusively for doctors, focused on enabling continuous medical education and professional networking. So on behalf of Docplexis and Strategic Institute of Public Health Education and Research, it's my absolute pleasure to welcome all of you for today's insightful webinar on very important topic, harnessing technology for management of hypertension with nutrition or systematic review. As we all are aware that hypertension remains one of the leading risk factors for cardiovascular disease, and effective management require more than pharmacotherapy alone. Advance in digital health technologies combined with evidence-based nutritional intervention are transforming the way hypertension is monitored and managed. So for this very interesting webinar, it's my absolute pleasure to introduce once again our esteemed speaker for today's session, Dr. Rakesh Gupta. And along with that, we have our intern, Mr. Gurpreet. Dr. Rakesh Gupta is the President and Director of Public Health Strategic Institute for Public Health Education and Research. And he is also former Director of Health Service and Director of Chemical Examiner Lab, Department of Home Affairs and Justice, Punjab. And he is also Fellow of IM Academy of Medical Specialists and member of Ethic Community, Chandigarh University Certified Tobacco Cessation Specialist, and also he is Chair Tobacco Control Section, International Union Against Tuberculosis and Lung Disease. And he is a member of Punjab Chandigarh Core Community by Vision 2022. So without further delay, I would like to hand over the session to Dr. Rakesh. Over to you, sir.
So we'll be talking about that harnessing technology for management of hypertension with nutrition, a systematic review. And Dr. Karamveer Goyal is with us as a subject expert. So I'll be talking about him in detail. So I'll be introducing the topic. So hypertension, as you all know, that it is leading risk factor for cardiovascular diseases worldwide. And there are dietary modifications are fundamental to its management. Yet long-term adherence remains a challenge, definitely. Technology-assisted dietary interventions, including mobile applications, the wearable devices, the telehealth and digital platforms, they offer innovative solutions to provide healthier eating behaviors and improve adherence of support with better blood pressure outcomes. So we have wearable devices, we have mobile applications, telehealth services are there, the data tracking and personalized feedback is there. So it is definitely important to have this. Next, please. So as far as the global hypertension crisis, there are about 1.31 billion adults which are affected by blood pressure. And in India, there are 220 million cases, and there are about 10.8 million deaths per year. And the male-female prevalence is 22.1% males and 19.4% females. That is quite a lot. Next, please. And the prevalence is rising from 1990, as you see that the graph, that from 1990 to 2030, the prevalence is increasing. And the key trend was the urban prevalence consistently higher than the rural is lowest, but it is rising steadily. And national average is tripled from 10% to 35%, 2025, in the year 2025. 2025 marked as a target year for 75 25 screening initiative. And India's NFHS data, which is the latest data, NFHS 6, it shows that 19.4% women and 22.1% men, they are hypertensive. Urbanization, then sedentary lifestyles and poor dietary health, they are primarily responsible for the surge. Next, please. Yes, Gurpreet, you can talk about it.
Yes, my voice is clear?
Yeah.
Over the last 3 decades, hypertension prevalence in India has increased dramatically. There are three types of diets which we can take, which we can use: classic Mediterranean diet, Indo-Mediterranean diet, and DASH diet. Classic Mediterranean diet includes plant-based food, olive oil, fish, legumes, and reduced BP, inflammation, and cardiovascular risk. Indo-Mediterranean diet includes culturally adapted millets, ragi, jowar, bajra, mustard, sesame oil, indigenous pulses like turmeric, garlic, affordable and vegetarian compatible. Dash diet include fruits, vegetables, whole grains, low fatty diet, reduced sodium, stronger evidence base for BP reduction. Next slide. Why the Indo-Mediterranean diet? Indo-Mediterranean diet making a bridge between cultural and science. Western Mediterranean guidelines face real barriers in India because a lot of the population of India is vegetarians, and Mediterranean diet include fish and other things which are really expensive for Indian people because we import from them from foreign countries. The Indo-Mediterranean diet preserves the original ratio while substituting.
Yes, Gurpreet?
Yes, sir.
Yeah, please continue.
The Indo-Mediterranean diet preserves the original macronutrient ratios while substituting. We are substituting olive oils to cold peas, mustard, sesame, and groundnut oil, refined grains to ragi, jowar, and bajra millets, and Western varieties to indigenous fruits, turmeric and fenugreek. And
Do you know what is fenugreek? Fenugreek is methri seeds.
yes,
Yeah.
sir.
Yeah.
And we are maintaining all the macronutrients and micronutrients present in the Mediterranean diet, and Indo-Mediterranean diet also help in maintaining our culture and also help in maintaining our physical health also. Next slide. Pathophysiology and nutritional mechanism. For knowing why hypertension is increasing, we also have to know hypertension biology and increase because of endothelial dysfunction, increased peripheral resistance from oxidative stress, impairs nitric oxides and biovalidity, and causing arterial stiffness and elevated BP. Because of nitric oxide reduction, oxidative increases, and that's why uh, our vascular resistance is increasing, which leads to elevated BP. And excess sodium intake also leads to the elevated BP. But in dietary impact, like in Indo-Mediterranean diet, all the oxidatives and uh, all the salts and everything is maintained. So it help in decreasing the vascular resistances and the hypertension and BP related problems. Next slide. Material and methods. Next slide. Study design is the systematic review. The study design is systematic reviews, which includes the data from PubMed, Scopus, Web of Science, Coherence Library, and Google Scholar, additional sources, AI tools, YouTube, various websites. And the search term for which I have used is hypertension, digital health, AI, telemedicines, wearable devices, DASH diet, Mediterranean diet, Indo-Mediterranean diet, blood pressure control, lifestyle modification. And the inclusion criteria for my study was peer reviewed 2015 to 2025 adults which are age more than 18 with hypertension, RCTs and cohort study systematical reviews and meta-analysis, reported systolic blood pressure and diastolic blood pressure outcomes. Exclusion criteria was pre-2015 pediatric case report and editorial pharmacological only studies. Next slide. Digital health technologies in hypertension. The digital health which are present in the present time and which are telemedicine, which help in remote consultations with physicians and dietitian, reduces barrier to continuous care, which also helps in maintaining our um, maintaining our consultations with our dietitians and other. And mobile health apps. Mobile health apps help us tracking our sodium intakes, physical activities, provide personalized nutritional recommendations. Wearable devices. In today's world, there are a lot of advanced devices for which we can wear and which continues measure our BP and our heart rate, and which help us to collect our data of BP daily, and it's very easy to collect data by using wearable devices in today's world. AI system. AI systems help in predictive analytics, automated treatment recommendation, personalized lifestyle coaching. In today's world, AI is very growing, is fastest growing thing, and it's also help in personalized lifestyle coaching. It also help in other thing, consultations, tracking, and keeping the data secure. AI is helping today in a lot of things, and which also help in reduction of hypertension a lot, which we can see in next slides. Next slide. The methodology was systematic review design. We have database. We have first done database search. After that, we have done eligibility screening. After screening, we have done data extraction. After that, we have made the analytical summary. And we have used a comprehensive search, use MSH terms and Boolean operation across 5 database inclusion required. The database we have mentioned in the previous slide, which we have used that. Next slide. And the results which I have concluded from it is next. This is our Indo-Mediterranean diet versus Mediterranean diet results. We have, as I mentioned, white standouts. Indo-Mediterranean diet is reducing 7.5 mmHg BP, whereas the Mediterranean diet is only reducing the BP with 1.5 mmHg. And we have changed olive oils to called pressed mustard, cream, sesame, groundnut oil, refined grains, ragi, jowar, bajra, and millets, western berries, indigenous fruits, and regional fish. We have changed fish to turmeric, garlic, fenugreek for anti-inflammatory effects. Indo-Mediterranean diet shows 5 times greater BP reduction versus classic Mediterranean diet, which is 1.5, and Indo-Mediterranean diet is 7.5 mmHg. Next slide. We can see the evidence-based dietary intervention that we have seen in the previous slide, like Mediterranean diet decreases by 1.5 mmHg, and Indo-Mediterranean diet, whereas reduce the SBP, systolic blood pressure, to 7.5 mmHg. And DASH diet is also a great diet for maintaining, like it also decreases hypertension by 5 mmHg. And DASH diet includes fruit, vegetables, whole grains, low fat diet, reduced systems SBP. And Mediterranean diet includes olive oil, fish, nuts, legumes, and cardioprotective, reduce inflammation and provides lipid profiles. And Indo-Mediterranean diet include pulses to American culturally aligned food. Next slide. These are the technology which we have talked about in the previous slide, technology in hypertension management, which is telemedicine. Enables remote consultation, healthcare professional and dietitian. Mobile app tracks sodium intake, physical activity, and provide nutritional recommendation. Wearable device allow continuous health monitoring. AI-driven tools and deliver personalized. The technology serve as behavior support mechanism, enhancing adherence to dietary recommendation and improving long-term cardiovascular outcome. It also helps in maintaining long-term adherence for the diet and our physical health. Next slide. These are the key results which I have concluded from Indo-Mediterranean diet and digital technologies. First table shows the outcomes of Indo-Mediterranean diet. Before using Indo-Mediterranean diet, the systolic blood pressure was 160 mmHg, diastolic was 103 mmHg, and No, previous slide. And which reduction was after intervention reduction was 148.2 mmHg in systolic blood pressure, which is 11.8 mmHg, and diastolic blood pressure it was about around 12.8 mmHg. And technology and the second table shows the remote BP monitoring technology function and clinical benefits. Second table shows the technology we are talking about remote BP monitoring, home BP
Gurpreet,
tracking.
can you please read the key results? It is 160 millimeter mercury and 148.2 millimeter. Can you just reread it?
Read it again.
Yeah.
Okay, sir. The systolic blood pressure was before using diet was 160 mmHg. After that, after intervention, it was 148.2 mmHg. And this diastolic blood pressure was 103 mmHg before diet. After that, it was 90.2. And resident HTN was 17.9% before diet. After diet, it was 5.3%. So can I move forward?
Yeah, sure.
Remote BP monitoring, home BP tracking, better BP control, machine learning, risk prediction and liberation. Titration, improved decision, digital twins, personalized simulation, future personalized care, explainable AI, transparent decisions, and greater clinical trust, and federated learning, privacy preserving sharing, and improved scalability. Additional AI outcome. Can you move forward to next slide? This was the main data we have concluded from our systematic review. That was after using AI lifestyle coaching, the the reduction in SBP in our blood pressure was 15 mmHg, whereas when we were using Indo-Mediterranean diet, it was 7.5. AI lifestyle coaching, we have included both the diets and technology. Like we have used AI and we have used AI and diets together to get a better results in it. Digital titration also have 6.5 mmHg, and dash diet have 5 mmHg reduction. Smartphone BP app also have a 5 mmHg reduction. Mediterranean diet have 1.5 mmHg reduction. These are the main data we have concluded from it. Next slide. This is a whole poster of our study, which can include introduction, objective of studies, methodology, finding and discussions, public health implication, and conclusions. We will talk about conclusion in the next slide. The synergistic advantages. Diet address physiology. When we include Indo-Mediterranean diet, it provides us potassium, magnesium, and antioxidant which improves endothelial function, reduce oxidative stress, and lower peripheral vascular resistance. When we use technology-driven adherence, digital tools enable tracking, real-time feedback, and a behavior reinforcement, addressing the number one barrier to control hypertension. Combined is equal to superior outcomes. Integrated intervention demonstrate greater BP reduction, improved medication adherence, and enhanced cardiovascular risk reduction versus either approach alone. Like we concluded in results that AI lifestyle coaching also helps a lot to reduce in the hypertension and BP reduction, and that's what we have concluded from. If we use diet, it's also good, but it also help in reduction. But it is not like if we combine both of them. Technology also help in maintaining tracking, real-time feedback, and behavior reinforcement. And by combining them, we have concluded that it increases a lot. Next slide.
Yeah. Okay. So the key conclusions are that digital health technologies, they facilitate the continuous monitoring of the blood pressure, dietary habits, and lifestyle behaviors. And artificial intelligence enables personalized dietary recommendations and real-time health guidance. The integration of diet, digital tools, and AI improves patient adherence to the hypertension management plans. Remote monitoring supports the early detection and management of the blood pressure fluctuations. Personalized data-driven interventions that enhance the effectiveness of the lifestyle modifications and the treatment outcomes. This combined approach that promotes the sustained blood pressure control and long-term behavioral changes. Together, the Indo-Mediterranean diets and digital health technologies and AI provided a patient-centered strategy for reducing the cardiovascular risk and managing hypertension effectively. The Indo-Mediterranean diet is an effective dietary strategy for reducing blood pressure and improving the cardiovascular health. Next, please. So the way forward is that we do need clinical trials, multi-center RCTs with the longer follow-up across diverse population, AI advancement, personalized nutrition, risk prediction, and unified management platforms are required. Then policy and access is standardized guidelines, data privacy, digital literacy, LMIC integration. Then the Indo-Mediterranean diet is definitely more culturally appropriate to us Indians. Next, please. So these are the references. You can just go through it. And Gurpreet, I'll just suggest that since Dr. Karamveer Goel is a very, very popular clinician in Ludhiana, so please note down whatever he suggests, right? Thank you.
So, dear
Yes.
users, I would like to invite our chief guest of today's event, Dr. Karamveer Goel. He is a director of medicine and HOD ICAI Hospital, Ludhiana, Punjab. He is a co-chairman of ethical committee, Punjab Medical Council of India, and he has more than 40 years of experience in post medicines, government district hospital. So he trained more than 100 doctors with certified courses in diabetes. So without further delay, I would like to hand over the sessions to Dr. Karamveer Goel.
Good evening, everybody.
Yes.
Thank you
Yeah.
for nice introduction. And right at the outset, I must thank Dr. Kesh Gupta, the chairman and director of Sapphire, to inviting me to this important seminar and webinar to be being conducted on hypertension. And I think nothing can be said more about the importance of hypertension in our day-to-day life. And as we all know, hypertension, in your slides, you show that what is the prevalence rate at present and more in urban areas, and it is on the rise for the last 3 or 4 decades. And as a physician or a cardiologist, I can tell you the number of people suffering from hypertension is much higher than what we perceive. Normally, if we see that if 100 people are suffering from hypertension, 50% of people, they don't know they are having hypertension. And those who know they are having hypertension, 50% of them, they don't take treatment for hypertension. And those who take treatment for hypertension, only 1/3 of them are controlled with the targeted therapy or non-pharmacological measures like dietary management and physical activity, stress and sleep control, etc. And only, not in nutshell, only 10 to 12% of the people who are hypertension, they achieve the target of less than 140 and less than 90 on a long-term basis. So that is the magnitude of the problem which we are facing in the especially in India with respect to hypertension. Now, secondly, what I want to reiterate here is people should not, only depend on medicine treatment. As your seminar is of great importance today, they have to resort to their lifestyle modifications in terms of diet control, weight control, stress control, and sleep management, and increase physical activity. And of all these things, most important is your diet and weight control and your dietary modifications, as rightly said by Dr. Rakesh Gupta and our intern, that we should go further with all the studies and RCTs and everything to establish the role of dietary modifications on a long-term basis to improve the outcomes of hypertension. As we all know, the major complications of hypertension are either cardiovascular complication in the myocardial heart disease or cardiac failure, and cerebral vascular disease in the form of paralysis, hypertension and eye diseases, and CKD means chronic kidney disease. The beauty of the fact or the problem, or I will say the tragedy of the problem, is that all these problems generally they are symptomless, as is hypertension, and people approach or contact the doctor or the hospital only when they have suffered with a major catastrophe, because they are symptomless, they have no major day-to-day symptoms, they don't know they are having hypertension, because hypertension can only be detected by getting oneself checked up. Once you get then only you will know that you are having hypertension. Then once you know it, you have to have a regular follow-up for it. And in that, your today's seminar is of very important, great importance, because here you have said that home monitoring and continuous ambulatory blood pressure monitoring, these are the new tools coupled with the assistance of digital monitoring as well as AI, to have a long term and persistent effective controlled blood hypertension, rather than the occasional visits to the doctor or the clinic or the hospital. So that is one aspect of the thing. And now the second aspect of the thing regarding the dietary modifications, beautifully described by the doctor Gupta and the intern, that the DASH diet, dietary approaches to stop hypertension, with the Indo-Mediterranean diet, they are the best approaches which we can practice and propagate, and you can say give a spread the message of that for controlling blood pressure, uh, maintaining your blood pressure with persistent values, desired values to the target level, and thereby postponing, if not preventing, the long-term complications of the hypertension, and thereby improving the quality of the life in the later stages of life, and ultimately culminating to the longevity of the life. So I will, say three cheers to you, both of you, to have such a seminar, beautiful seminar. And just to add, I will say a few tips. I will, in as far as your day-to-day diet is concerned, you should avoid 4S. Most important: salt, sugar, saturated fats, and smoking. There are four major important things in your day-to-day diet which you should be curtailing. If not, especially cessation of smoking is number one, and rest of the three you should take a minimum in quantity. Avoid 3 P's: pickles, papads, and processed feeds. Okay. Then avoid ABC: alcohol in more than moderate quantity, bakery items, chips, etc. So, and because we in Indo-Mediterranean diet or Mediterranean diet or in DASH diet, we always advocate that people should be focusing more on calcium, magnesium, and potassium rich diet, than on the other way, reducing the sodium content in their diet. As you were saying in your lecture, in the the talk in the beginning, that your salt intake has to be low. If you are detected hypertension, not even 3 grams are allowed per day. Less than 3 grams, it should be limited to 2.3 to 1.8 gram per day. That is less than 1 teaspoonful. Okay. Am I audible? Hello.
Yeah.
Okay.
Yeah. You're audible.
That is a salt, And as you said, legumes and vegetables and nuts, they improve the quality of the endothelial function by reducing inflammation and increasing the vasodilatation, or increasing the nitric oxide, thereby decreasing the stiffness in the blood vessels, causing less peripheral resistance. On the other hand, and whereas sodium intake decreases the blood volume and decreases the pressure on the blood vessels. So on both factors, we have to control our hypertension with dietary modifications and with diet control. And medicine should be the last pillar in your blood pressure control, apart from your diet and weight control, physical activity, stress control, and proper sleep according to the circadian rhythm. Once again, Dr. Kesh, it is a very important, really, I'm speaking from my core of my heart. It's a very important thing which you have taken up and your organization has taken up. And it is the need of the hour in especially. I must congratulate you and wish you all the best for future endeavors also. Thank you very much.
Thank you. Thank you.
Thank you.
So thank you so much, Dr. Rakesh and Dr. Karamveer, on behalf of entire Doplexis team. We really thanks to all our esteemed faculty member here, Dr. Rakesh Gupta, Mr. Gurmeet, and our chief guest for today's event, Dr. Karamveer Goyar, for sharing your deep and practical experience on such a very important topic, harnessing technology. Sorry, harnessing technology for management of hypertension with nutrition, a systematic review. And we also like to thank all our participants for joining us today for your active engagement throughout the session. And we hope you found this discussion very informative and clinically relevant. So on behalf of Doplexis and Sipher, we look forward to welcoming you all for our upcoming educational program. Till then, have a great day ahead to all of you. Thank you so much, sir. Thank you, Dr. Karam.
Okay, thank you, Sipher. Thank you, Dr. Karamveer.
Thank you, Dr. Kesh, once again. Thank you.